My name's Dr. Anna Campbell and I work at the University of Dundee. For the last 10 years, I've been working in the area of cancer and exercise. Overall, being active during and after treatment can give you a lot of physical and psychological benefits. Physically, it can make you feel stronger and more able to do your normal daily living. And psychologically, it can actually boost your mood, make you feel more positive and help reduce any anxiety or depression that you may have.
I'm Richard Cranefield. I live in Kingston and I had hairy cell leukemia. I can only speak for myself, but I'm sure that most people that have been through cancer find it at times pretty depressing and get quite low. And I was, even after my treatment, was feeling quite low a lot of the time. And I found that going down the gym actually removed all of those low points from my life.
One of the main debilitating side effects of treatment is fatigue. So actually, contradictory to what you may think, if you actually stay active, you will become less tired. Now, some of the treatments, some of the hormone treatments can actually affect your bone density. And so it's very important that if you stay active and do weight-bearing exercises like walking, you can actually reduce the bone density thinning that can happen. During treatment and after treatment, there's also sometimes a problem with either weight gain or weight loss. And in particular, the evidence is showing that if you can stay active, you can manage your weight a lot better.
My name's Heather Lawrence. I live in Muswell Hill and I have secondary breast cancer. The hormone treatment that I'm on made me put on weight, about 2 stone in total. So I really did feel very bad about myself at that point. And for my own self-esteem and also to help make me feel like I was doing something to help my treatment, I started exercising.
With some of the cancer treatments, you will actually lose a lot of muscle mass, and therefore it's quite important with physical activity to build those muscles back up again. So doing little simple muscle strengthening exercises will help you to gain that muscle mass, which will allow you to go on with your active daily living.
My name is Lorna Nim and I live in West Acton. I had breast cancer. Joining a gym was the best thing I've ever done. It's helped me to understand myself physically, what I need to do to keep healthy, and also it'll help to stave off any sort of future illness, hopefully.
There's some emerging evidence actually being physically active after a cancer diagnosis can protect you from the cancer coming back or dying of that cancer. The evidence has come from colorectal, prostate and breast cancer survivors.
6 to 8 months after my treatment, I decided that I was going to start getting a lot fitter. Mine's a chronic condition and I will have to go through chemotherapy again. And I wanted to get, battle fit, as it were, to try and get my fitness levels up so that if in a year's time or 10 years' time, when I have to have chemotherapy again, I'm starting off at a reasonable level of fitness.
There are 3 different types of physical activity that people need to incorporate. Aerobic exercise is when you're using the large muscles in a continuous, rhythmical way. A great example of this is walking. What you have to do to get the benefits for your cardiovascular, your heart and your lungs, is you have to work fairly hard. And what I mean by that is where your breathing begins to become a bit more frequent, a bit heavier. You feel as if you're getting a bit warmer. Your face may have a warm glow to it. These are all signs that you're working at a moderate intensity, which is the intensity needed to get the health benefits. The second type of exercise is muscular strength or toning. What you need to do to strengthen your muscles is work them a little bit harder. An example of this is carrying shopping. For muscular strength and toning, you can use hand weights, you can use resistance bands, or you can use your own body weight. The third type of exercise is flexibility and balance. Now, flexibility is stretching the muscles so you improve the range of movement around the joint. And this is good for daily things like reaching up to get something out of a high shelf or kneeling down to tie your shoelaces. And finally, balance. A lot of people find that with cancer treatment, their muscles aren't as strong as they used to be and their balance isn't as good as it used to be. Things like Tai Chi and yoga and Pilates are excellent examples of balance and flexibility exercises.
On some of my better days, I did manage to, I get up out of bed, do a little bit of yoga or just stretching, and that kind of just boosted me for that day, really.
During treatment, it's natural that you may feel tired and run down and poorly. Any type of physical activity is better than nothing at this stage. So it's important to pace yourself and gradually build up your physical activity levels. One problem some people find is when they feel good, they do far too much, and then the next day they're absolutely exhausted. Therefore, it's important to listen to your body and do as much physical activity as you can, depending on how you're feeling on that day. So the aim is to accumulate 2.5 hours of physical activity each week after treatment. Now, this can be done in small packets, like 10 minutes, or it can be an hour and a half or 2 hours of physical activity. Everybody is different, and everybody will have different types of physical activity that they will like to take part in. For example, gardening, golf, aerobics classes, walking, playing with the children.
It was really hard to actually get moving. When I first started running, I'd sort of spend about half an hour thinking of anything I could do to avoid actually going out and hitting the streets. But I gradually started to enjoy it, and I came back with such a buzz after going for a run. I really felt like I wanted to get back out there, so I increased the amount of times I was getting out for runs, and I just felt completely better as a result, much happier, and I was looking better as well, which was really important.
To find out about more activities in your area, if you're interested in becoming more active, you should contact your GP or get in touch with your local council, or indeed contact Macmillan, who will signpost you to leaflets and also information on the internet.
Now I feel much stronger in myself, which is really important. And I don't come home from work feeling exhausted anymore. I'm sort of ready to go out of an evening, which is really great and means that I can enjoy life more.